Good day, everyone. My name is Jesse Cobillo. I am the Patient Service Specialist for Quality Insights Reno Network 3. We cover New Jersey, Puerto Rico, and the U.S. Virgin Islands.
And I'm Renee Bovacalis, Patient Engagement Specialist for Network 5, which covers Virginia, West Virginia, Maryland, and DC.
Well, here we are today to introduce you all to our new program, Empowering Partners for Improved Care, a program that will assist your facilities with patient engagement in your QAPI meetings. We're going to go step by step on how your facility is actually going to implement this project in your facility. And any questions that you may have, you will have the opportunity to present these questions after you watch the video that we are recording here for you today. So as you go through this process of listening to us explain the project, please feel free to write down any questions. And then at the end, you have an opportunity to submit questions to us directly, and we'll be able to answer them back to you all in a complete format where we'll gather all the questions and provide feedback to you all so that we can answer everyone's questions accordingly. So Empowering Partners for Improved Care. You may all be familiar with a previous project that we implemented with your facilities where we asked you to engage patients in QAPI meetings. This year, CMS has implemented a new contract where they are also requiring that we partner up with the dialysis centers and provide assistance on facilitating the process of engaging these patients in your QAPI meetings. Many of you are already doing this. Many of you have stopped doing this because of COVID, and we understand how impactful COVID has been to the operations of the facility and the processes that you have previously established. And so we want to be able to provide you some technical assistance. We want to be able to walk with you hand in hand in improving the practices that you once had established, or if you had not had established this process, we want to be able to also bring you up to par with what CMS is expecting of dialysis providers. So our goal with Empowering Partners for Improved Care is that dialysis facilities will establish a process year-round, not just for the duration of this project, but year-round, to engage at least 2 patients, family members, and/or caregivers in the facility's quality assurance and performance improvement meetings, QAPI meetings. These members will be recognized in your QAPI meetings as patient or family member facility representatives. You may also give them the name of subject matter experts. Many of you already have recruited subject matter experts to participate in our Patient and Family Council, the PFAC, or Renee's PAC, the Patient and Family Patient Council as well.
Advisory Committee.
The Advisory Committee, thank you. And so you could utilize those same members that you have engaged at our network level. You can engage them also in your QAPI meetings. Therefore, making and building a connection between what's happening at the network, bringing that information to your QAPI meetings, and vice versa, kind of building a better relationship with those members. And we'll be able to provide them support, coaching directly on how to move forward with engaging as better partners in your QAPI meetings. So that's just an idea that I'm throwing out there ahead of time. That way you don't think that, oh, I have to go out and recruit new members. If you already have members that are participating with us, make the most out of those members that you're already engaging, that we are already engaging at the network level. So together with these members, your participation with them is going to be with the interdisciplinary team, brainstorming ways to strategize or to impact initiatives that are being implemented at your facility, including plan of care, peer mentoring, patient depression screening and referral, home dialysis, transplant, and the list goes on. There are other relevant topics that you're also going to be discussing in your QAPI meetings. One thing I do want to highlight, and I know this is a concern of everyone, is we cannot have patients participate throughout the whole meeting because there are some topics that we discuss that are patient sensitive that we don't want other patients to be a part of, and that's completely understandable. You can set your parameters of what time it's expected of the patient SME or the patient representative to participate in the QAPI meetings. And we'll go a little more in depth to our discussion about this later on. But you can also address topics such as the ICH caps, the scores that your facility is getting. Is not limited to whatever list you're seeing here. You are actually able to engage further discussions with your patient and family representatives. Okay. One thing I do want to highlight, your facility must be able to demonstrate having effectively established this practice of integrating these representatives in your QAPI meetings. We are asking that you at least are able to show us that you had them participate in 3 QAPI meetings during 2021 and 2022. We, of course, are going to be monitoring to make sure that after those 3 meetings, you're still doing this process. The idea is we want to make sure that you have at least 3 so that we understand or we know that you have a sustainable process. It's not to say that 3 is my minimum, I'm done, and I'm just going to stop paying attention to doing this. The idea is that we want to be able to help you create something that's sustainable, that if the Department of Health, the network, we go into your facility and we ask, what have you done with patient engagement? You could quickly say, we have a patient representative participating in our QAPI meetings, and they are established members of our QAPI meetings. And here, let me show you what they've brought to the table. And we're gonna help you kind of build on that as we progress with our discussion today, okay? Okay. We want to be able to provide you the tools to be able to report on a monthly basis your patients or family member representatives' actions or discussions in QAPI. I'm going to hold off on this topic for a second because I want to share with you all some tools that we put together to help your team be able to recruit if you don't have a patient or family member representative. And these are some of the supportive tools that we've developed to help you do just that. The first thing that we want to make sure is that you have a interdisciplinary team acknowledgement and commitment of support. The reason why we created this document is because we understand that oftentimes the task of working with patients falls back on one staff. Usually that's the social worker. I want you all to kind of understand that CMS is looking at patient engagement not as the sole responsibility of one member of the facility, but it is looking at patient engagement as a collective, as a teamwork, as a team effort. So just as you have a social worker participate in your QAPI meetings, just as you have a dietitian participate in your QAPI meetings, a doctor, facility administrator, the expectation is that you now have the patient's voice included and that role included in your QAPI meetings as well. So what we're doing with this form is that you're getting a buy-in from your team and saying, we are committing to make this happen in our dialysis center. We are going to work with a patient representative to be an integral member of our QAPI interdisciplinary team. So what we ask is that everyone signs this document, the medical director, facility administrator, social worker, head nurse, dietitian. And as you can see, we have a patient and family member representative in here. That's only if you currently have someone that it's already participating in your QAPI meetings. If you don't have someone participating, a patient or family member participating in your QAPI meetings, this is not required, all right? And we put a disclaimer on the bottom. This is not a legally binding document. It is only meant for the sole purpose of tracking your participation and your engagement in this program. Not for it's not a legally binding document. And if we do go into the facility, if we have a discussion with you and say, hey, can we see the documents that you put together in support of this project or in support of your patients participating in QAPI meeting, this might be something that we request. So save these on your record, save these in your for future reference. The next document,
save all your documents, but we don't want you to send them to us. It's something you want to have as a record of your involvement and the activities that you've put together. So just hang on to those, have them available. If we ask to see them, produce them.
Exactly. The next document that we put together for you, and you could adjust, you can make changes to these following documents as you see fit for your dialysis center. We left the space open here for you to be able to enter your facility's name, but this is going to be used for a recruitment letter. This letter is not just going to be used once. This, we usually, if you run a project, you said, all right, this is what I need to establish at the beginning of the project. Well, that's it. No, this letter is going to be what you're going to use to have an ongoing recruitment process for your dialysis center for identifying members, patients, family members, or caregivers who might be interested in participating in your cooperative meetings. As I mentioned, you can make adjustments to this letter, make it fit the needs of your facility in specific, or if you want to add a personal message to it, you could do that as well. We're just providing you a basis for something that you could use for recruitment purposes. If you are able to recruit a patient or family member to participate in your cooperative meetings, down the road you find that this person is no longer able to participate. Now you're left basically with no one. This is the material that you're going to use to once again do that whole recruitment process and then recruit someone else to join your cooperative meeting. So don't just think about it as a one-time use. It's something that you're going to be able to implement and use every time you need to do that recruitment at your facility. Patient and family representative participation and membership policy. We thought this was very important from previous experiences that we've had with integration of patients in cooperative meetings. We wanted to give you a basis as well of what is expected in the cooperative meetings, give the patients an understanding of what the cooperative meetings are, the standard for attendance, what is expected in the attendance form from those members, just as you expect the doctor to be a member or participant in the cooperative meetings, and you expect the social worker to be a participant in these cooperative meetings, you would hold this patient or family member representative to the same level and to the same standard of participation in these cooperative meetings. And something that we wanted to share with you all and kind of make known that you can share with your patient. This you're going to share with your application process. I just want to highlight that with the previous letter, so that patients have a notion of what to expect when they are selected to, if they are selected to be a participant of your facilities cooperative meetings. So one thing we did want to highlight is the do's and don'ts of participating in the cooperative meetings, respecting each other's time, giving value to the diverse opinions of the members. But things that we want to also highlight is not to, like, things that the members should not do, argue, engage in arguments that are not productive to the discussion that's currently happening. Don't be negative, don't be distracted by your phone, etc. So you could add to this list, you could make it your own. If there's something you thought, hey, this is something that should have been added in there, add it in there. And in addition, maybe let us know, hey, by the way, when I was reviewing this document, I thought this would be a good idea to include in that form, because what we want is we want to improve on the work that we are sharing with you, the tools that we're sharing with you. So share that back with us so that we can be able to implement it and add it for future years as well. Okay. And last but not least is the patient and family member representative registration form. We added the basics: name, home address, cell phone, and email address. As you know, these are your patients, these are family members you're familiar with. So you will have the main information for those members. But we wanted to highlight that, you know, they're signing an agreement to become a candidate, and they acknowledge that the participation is voluntary, that they're willing to become the facilities representative, and they agree to having read the responsibilities. They agree to authorize you to be able to share information if, let's say, the Department of Health comes in and their name is in the minutes, that, you know, that information is clearly stated in the minutes. So it's just giving you a part of the process that they are acknowledging that this is what they're agreeing to. As you can see on the bottom part here, it is grayed out. That means the reason we did that is because you may have 5 patients and family members combined that want to be a part of your facilities cooperative meetings. You can then use this form to say, okay, we have 2 open positions, or we have 3 open positions that we want to fill for this. At this time, we're just going to fill 3 positions instead of 5. We just, you know, we're working on learning how to do this process, so we don't want to be too overwhelmed. So you could start with the 3. Now we have someone as a backup in case one of them drops out for any reason. And the way that you're going to do it is those 3 members that you're selecting, that you are selecting as the candidates to be members of your cooperative meetings. The team will then come to a consensus and agree that this is the member we want to be able to join our cooperative meetings, or this is the member that we want to be able to join our cooperative meeting. And you can have a discussion about what are some of the qualities that member might be able to bring to the table. You know, have a discussion about what is it that makes this a ideal member to join your cooperative meeting. And so just as you would hire someone for a position, this is exactly what you're doing. And this is your recruitment material for your patient and family member representative to join coffee meetings. Okay.
One of the benefits of having more than one patient involved in this or family member involved in this is that you can rotate it. So the demands on the one person is lessened. So if you're able to rotate, then you can have one patient attend 1 month, or every other month or whatever. So it just kind of spreads it out a little bit and is less of a burden for anybody in particular, but also just a great opportunity to involve more people in the process and get more input.
Yep, definitely. And one thing I'd like to add to it is that you're going to find that if you have multiple members participating in your co-op meeting and you're trying to balance how are we going to have them engaged, that's some of those interventions we'll share with you in the future. And we can talk to you one-to-one, coach you, provide some technical assistance on how that's going to work and how you can do that. But we'll provide you more in-depth ideas on how to make that happen. One thing I do want to highlight is that it's always good to have more, not less, because if you have more than that group that you have selected, so you say you have the 5, you select the 3, you could keep those other 2 as backup and say, at this moment, we're only going to fill in 3 positions, but we're going to keep you on a waiting list. If something were to happen to one of our members, or now we're more comfortable integrating new members in different efforts, then you'll be able to then pull in from that group of candidates that are interested in filling this position. At the same time, in the future, you can use those members that have participated for some time in your co-op meeting to help you coach those new members that are coming in and be integral members of your co-op meetings. Okay. So remember, these 3 forms: patient and family member representative registration form, the patient and family representative participation and membership policy, and the patient and family or caregiver recruitment letter. Those are the 3 that you're going to put out there for your patients. You're going to share those 3 forms with them. You could do it as a packet, put a couple of them in the lobby with, like a small sign saying new positions open for patient representatives, like something catchy, like make it fun. And just as you would, promote with your HR a new position for a social worker, a new position for a PCT, or a nurse at the facility, you want to do the same thing. Make this interesting, make it attractive for them, and discuss with them how you're going to be doing this integration in your co-op meetings and what does it mean to be part of those co-op meetings. Okay, but it's
an important and prestigious position.
Exactly. Give it that value. It is not something that's going to be taken lightly. It's something that you are going to be interviewing. If you need to interview the patients or the members that are going to be a part of it, you could do that too. Conduct a one-to-one discussion with them and the interdisciplinary team. Why is it that you would like to be a member of our co-op meeting? And what are your expectations of being in a co-op meeting? So make it so that it's something that they see as, wow, this is, valuable. And at the same time, a big deal. And you are creating a process that gives value to this position, because it's not something, as I mentioned, it's not something we want you just to do for 3 months, 4 months. It's something that you should now have established as a standard practice in your dialysis centers. So we want to be able to keep you up in par with those new requirements that CMS is looking forward to. And as I mentioned earlier, we have close communication with the Department of Health. So we do share we share the work that we're doing with them. We share which facilities are participating in this project, what are the expectations of those facilities, and they are going to be looking for what are you doing with patient engagement, because it's a big part of the work that CMS is encouraging everyone to do. Okay, so remember, use those 3 forms for that. This one form is only for your interdisciplinary team, just so that you can have a buy-in from all members to actually make this happen. And if anyone listening to this presentation says, oh, I feel like I'm going to have some pushback from our staff, give us a call and we'll work with you to maybe get that message to the rest of the team if need be. So I'm going to scroll up again. And this is, now that you have your patients or family member representative selected and you're going to start engaging them in your co-op meetings, we want to be able to hear from you and capture what is it that you guys are talking about, what is it that you guys are working on. So we've developed a website. There is a page that we are going to be sharing with you. It's actually, the link is right here on step 2. But I don't want to get ahead of myself yet by going to that page. You're going to go to this page to report on a monthly basis. What have you done, or what is it that happened during that discussion in QAPI meetings when you invited that patient to participate in person, or if that patient maybe wasn't able to participate in person, maybe via Zoom call or teleconference. Preferably, you want them to be in person, just as you want your team members to be in person. That's the same thing you will want them to be there in person. We understand COVID and restrictions that are happening with COVID now. So be flexible in your first few meetings if you need to, but the expectation is that you will have the presence of that patient or family member representative in QAPI meetings. I understand some of you say, oh, but we talk about the QAPI meeting, then we bring the discussion to the patient, then we bring the patient's feedback onto the meeting. That's ideally, would you do that with all of your other members in your QAPI discussion? Would you say, all right, the doctor's feedback was this, the social worker feedback was that, the facility administrator's feedback was that, let's bring it together to whoever's meeting. No, you want everyone to be members and active participation in that meeting. So it's important that you make a point to have that patient also participate. Don't look at them as a patient now. They are your facility representative, your patient and family member representative. That's the role you're giving them, or a patient and family subject matter expert. They are your partner. You're filling a position that needs to be filled in your QAPI meetings. And so I want you guys to look at it that way, give it the importance, give it the meaning that it deserves. Okay. So we ask that this form that we have here is basically for you to be able to, in your QAPI meetings, you can have it with you and capture when you're having those discussions with the SMEs, or the subject matter expert or facility representative is engaging in the QAPI meetings. You can then select, oh, we talked about plan of care and how we're going to impact plan of care. The SME helped identify barriers to patients and our family members' development of plan of care and participation in the plan of care meetings. Oh, our SME helped us with feedback to improve the way staff approach the plan of care processes and meetings. All right, we talked about plan of care, but it wasn't about any of these topics that are here. It was something else. Type that in, like write it in so that you can have it as a record. We provided you for each topic that's in here, which is reflective of the topics that are in the previous page, because that's the work that CMS has tasked the networks with implementing. As I mentioned, you're not limited to these projects. You're not limited to these topics. Some of you may not even be participating in one of these projects with the network, but it's something that you are addressing at your facility. If you're not in the home dialysis project, you are promoting home dialysis with your patients. You are working in promoting telemedicine for home dialysis patients. Infection rates. So let's say your facility was not selected to work in the infection rates, reduce infection rates at your dialysis center.
Still something that's important that the facility should be looking at on a monthly basis. Most of these topics are required by the conditions for coverage to be discussed in these meetings on a monthly basis. So
exactly.
Just part of it.
We provided you for each one of the topics some action items, some things that you could be doing with your patient or family member representative, or your SMEs also you call them. And it gives you an idea of like, wait a minute, I didn't think about that. Maybe our SME can give us some ideas on how to improve engagement of peer mentors and mentees. Maybe we could ask him about that, and that would then trigger you to have that open discussion with those members. So we just added these as examples and a way of us being able to make it easy for you to report on a monthly basis as you're doing work. Don't just go in and select this, and that, because if we go back to your facility and say, you said you had some ideas from your SME about improving partnering up with your patient mentors to recruit members. How did that go? How did you do that? So if we start asking for information and proof, then you're going to have to back that up. That statement needs to be backed up. And we're going to be doing that. We're going to be reaching out to you, and we're going to be making sure that, you're not just selecting things for selecting it, but that it's actually on the basis that you actually did some actions to support that action item that we shared with you. And as I mentioned, they're used for ideas to provide you with a push to, all right, maybe I should be doing this. and what can I be doing? If your facility did not have a patient or family member representative engage or participate in the facility's coffee meetings, you are still going to be required to complete this monthly report, because we want to be able to know what is holding you back from maybe recruiting a member, from maybe engaging them in the coffee meetings. So it's basically doing like a root cause analysis and give us an understanding of the barriers that you're encountering when engaging patients or trying to engage patients in your coffee meetings. And then that will give us an idea of what we need to provide you as a group or as an individual facility, what we need to provide you with assistance or technical assistance or support. So we want to be able to capture this on a monthly basis. In previous years, we only require you maybe to report if you had participation or something like that. We are requiring every facility that's engaging or participating in this project. We're asking everyone to report. That way we understand what's going on and we have a good idea of where everyone is at. Okay, so use this form, as I stated here, step 1, use this form to help your team manually capture action items, outcomes from your representative's participation in the coffee meetings. Using this form is optional. You don't have to do it. We're just providing it to you so that you can have a visual of what you're going to be expected to report or what you're going to see in this link that we're sharing in here, this reporting link in here, okay? But the step that you are required to do is step 2, which is document the participation in coffee meetings using the network online report. And as I mentioned, as stated here, require monthly whether your facility had a patient or a family member participate in the facility's coffee meeting or not. So either way, you're going to do it. And
that link's going to be different for Network 5. So don't copy this one for Network 5.
That's correct.
We will send you the links.
Yes. We're just using this format for presentation purposes, but that's not the link you're going to follow. This is just for Network 3's link. But yes, you will have a link here for Network 5 as well that will be reflective of that. When you are done with completing this report online, it's going to give you the option of printing the report, and that report you can have that copy and add it to your coffee meeting notes, and that's now proof that you had something legible. You're now going to have something legible saying this is what we did with our patient representative, and this is what we engaged them in discussion with. These are the topics that we talked about, and elaborate. If you have others, always elaborate. What is it? What is the other stuff that you talked about? What is the other topic that you engage your SMEs in discussions? And there's also an option at the bottom that's other, so that if none of these topics are available, you do have the option of other, so that you could be able to elaborate on what those efforts were. One thing I do also want to highlight is that this is going to show proof of your SMEs or patient and family member representatives participation in COAPI. You know how your signing sheet for COAPI meetings has all the roles listed? Update that sheet with now patient and family facility representatives or patient and family subject matter expert as one additional role that you're putting in that signing sheet, because you want to be able to right off the bat, you know, if we're asking in a facility visit, we're asking, let us see your COAPI meeting minutes. And the first thing we open is that signing sheet. The first thing we're going to look for is, was your SME participant in this month's COAPI meeting? And the way we're going to know that is if their signature is in there and their role is right next to it. So don't write it in. That same signing sheet where you have everyone's titles typed in, create a new one and type that new role in there. So now you know that that's the standard that your facility is following. It's not if you write it in, I feel like I found facilities when they write it in, it's like an out. Oh, we didn't have someone participate in this month meeting. We don't need to worry about it anymore, or it's forgotten. But now if you have it permanently included as members of your team and it's typed in there, it's not something that's now optional. It's something that you are holding yourself accountable to completing and doing. Okay, so now we're gonna go quickly go over what that link looks like. Let me just go over to share that with you. Okay. Renee, you're able to see the webpage?
Yes.
Just want to make sure. Okay. So this is what, and as I mentioned, we're using Network 3s as an example. I'm just gonna like scroll. Let me just refresh the page, see what it looks like. This is just an example. It's basically going to be the same information for network 5. It's just going to be like different facilities and different name on top, but this is just for demonstration purposes. Okay. First thing you'll want to do is select your facility. So there's going to be a drop down of the facilities in here. What you're going to also do, you could type in your provider number. So you could start typing 312, and then you see like it starts sorting out by provider number 4, and then there's no data for 4. So you're going to do 312-315, and then he isolates that one facility that has that provider number. You see that? Or if you start writing Fresenius, or let me see, let's do the Vita. Let's see the Vita there. Vita. Then it's going to sort out by all the Vita facilities. He's probably doing like FMC.
Or if you just do Cherry Hill, start writing the name of without, yeah.
Right. You see Cherry Hill, like
yeah,
you write in the.
It doesn't have to be perfect.
Exactly, but it's going to help you. You don't have to scroll through the whole. The idea is that you don't have to scroll through this whole list looking for your facility. You're able to type in something that is to your facility, and you're able to then select it to include it in there. Once you, let's start with this. Let's use this one as an example. We added it there as an example. The reporting months. One thing I want to highlight is you're going to see that you have June all the way to June of next year. What's going to happen is, for example, I'm going to report for the month of June having, this is going to be my report. Make sure that one person is completing this report, because and that you are all in the same understanding of what's going to be included in this report, because once this report is submitted, the month is going to disappear from the list over here. So if I do the month of August, for example, the reporting month is, right now we are in July. For example, right? We're in July. I have my QAPI meeting yesterday. So I'm going to report for my QAPI meeting that we had in the month of July on the day of yesterday. So my name is, I'm going to type in my name, Jessica Bio, my contact email, so I can have, we can know who was it that completed this report. So if any member of the facility says, oh, but I can see my facility's reporting month there, what happened? Well, let me look to see what happened. Then we'll pull our database, and we say, oh, well, Jesse from your facility was the one who completed the report for that month, and we can provide that information to you. So as you can see, we're talking about our July QAPI meeting. Happened yesterday, right? We're going to select the date of yesterday, which is July 13th, and that's okay. If you try to, let's say, for example, select July over here, but then you go to June, I was like, oh no, we had our July meeting, but I'm gonna select the June 30th. Oh, wait a minute. You're gonna have this error, and you're not gonna be able to move forward, because the date that you select here needs to be the same as the reporting month that you're working on. So for example, if you had a QAPI meeting, but you had no patient participation in the QAPI meeting, you're going to select the same thing. So if, for example, your meeting was in July, your QAPI meeting was also yesterday, you're going to select yesterday, whether you had a patient representative or not. This is the process you're going to follow, okay? I have facilities.
Well, let's say,
yeah.
I was going to say, let's say that you didn't have a meeting in July because time just got away, and August 1st comes, and now you're going to do your July. How does that work, Jesse?
So basically what I tell facilities is just select the last day of the month in that spreadsheet. And that's a good point, Renee. So what I tell them is, there are people who say, oh, we had a July meeting August 4th because that's when we were all able to get together. But in August, we also had, on the 18th, we had our August QAPI meeting. So what I tell them is, don't worry about doing that, because if you select that in here, it's not going to let you do July. Oh, let me select August. You see, that's not going to happen. You have your July meeting, it's not going to happen. So what I tell them is, no problem. Just go in there and select the last month of the last day of the month, so that you can be able to move forward and continue completing this form. That's a very good question. So let's go back to this. Yesterday was our QAPI meeting. We're going to enter how many patients or family or caregiver subject matter experts participated in the selected QAPI meeting date. You're going to enter a numeric value. So if you put 0, you had 0 patients participate. we're going to get this warning, but that's basically saying, we understand that your team was not able to have a patient family member representative join this month's QAPI meeting. We will utilize the barriers and feedback you shared to develop additional interventions to help your team. And that's what you're going to share here. What are your barriers to engaging patient family member SMEs in your QAPI meetings? You're going to select, if it's this, you're going to select that. If it's that, you're going to select, so it's multiple. You can select multiple at the same time. And if it's other, you could select that as well. And then the other option is going to come over here on the bottom, and you're going to be able to type in your answer right there. Okay. Likewise, if the next question is, what is your plan for impacting those barriers? So it's been difficult obtaining commitment from patients or family members SMEs to serve in QAPI. What is your plan? Provide QAPI media orientation to candidates to minimize any fears or misconceptions. So you could select that. If you want to, if you're also going to work on this, you could do that. If you have other interventions, you're going to select other, and you're going to have another drop down here, and it's going to say, you're going to type in your answer. Okay, and then you're going to move forward, and you're going to go to the next step, which is where you're going to be able to verify, and then you're going to be able to submit it. Okay, that's only if you didn't have, if you had 0 for that month. But let's change that answer, and we had 2 patients participate in the QAPI meeting. The whole form now changes. You're not going to be asked to complete those first few questions. Now we're going to ask, your SMEs participated in QAPI meetings via in-person, teleconference, virtual, Zoom, something like similar to Zoom. As I mentioned earlier, this is the one we want to be able to happen. So you could select that. If one of them, oh, here's a good question. So you had 2 members participate, and you want to say, oh, but now both of them participated in person. One of them participated via teleconference, the other one participated in person. You could select the both of them, and you could include them in here. Or if the patient did not participate in conference and he did a virtual Zoom call, one in person, one virtual Zoom, then you could put that information in there. Okay, and then you'll press next. And here is the SME QAPI meetings engagement. Select the topics discussed during QAPI meetings with SME. Remember, I told you there's that list that we had on the form that we showed you early on. You're going to have the same list right here. You're going to have all the same topics over here, and at the end, you're going to have other. So if you select, for example, let's go with you could select multiple. So you could select plan of care, peer mentoring, whatever you want to select that you talked about with your patient, and other. And then, all right, so then those are the 3 topics you talked about. You're going to see that you have an option for each one. Do you have action items at this time based on the SME's feedback relating to this plan of care? Yes, I do. Oh, what are those action items? Those action items are the same ones that I showed you on that sheet early on the Word document, and there are the options that you can select. You select multiple if those are the ones that you work with. Remember, whatever you put in this report, we're going to follow up with you, and we're going to want to know how you did this, what was implemented, and what outcomes came out of it. So if you have other, you select other.
Right, because we're looking for best practices.
Exactly. You're going to type your answer in here. If you select other, type your answer in there, or whatever interventions you implement. So for peer mentoring, it says, oh, we talked about peer mentoring. At the moment, we don't have any action items, but we did kind of like address it just to like put it on the patient's mind. But we don't have any action items at the moment. We just said it's maybe a pending topic that we're going to address. And we just let them know about what the network is doing with us regarding peer mentoring, but we really didn't get any feedback. All right, you could put no for that month. If we start seeing that you're saying, oh yeah, we had action items for peer mentoring, and month after month you're saying no, something's going to be wrong. We're going to question, like, all right, you're talking about it, but there's nothing being captured. Ideally, you want to put yes, and if you want to say other, you could put other and then type in your answer in there. Okay. The no is kind of like a last resort. We know that if you're selecting this, it's because something happened. There was some discussion that took place. So you're going to be able to type in your answer as well. Okay. And then for other, we have this in here. Do you have additional action items at this time relating to other topics based on SME feedback? Yes, I do. And I want to be able to enter that information. Type. Once you have all this put together, you see it looks a little cumbersome right now. At first it looked like organized, but it's step by step. It makes it easier for you to visually kind of take it all in as you're moving down this form. rather than having the other one that we showed you, which is all multiple pages. This is easier to see on the eye. And remember, the document that I showed you earlier with all these options you're seeing here, you could use that for your own reference, so that if you're in the QAPI meetings and you're like, oh, we're talking about plan of care, the SME provided feedback to improve the way our staff approach the plan of care processes meeting. Oh, maybe let's engage them in that discussion. Is that something that you can help us identify? You know, use that for your reference and then check it off and then add your notes under the other. That way you can be able to have something that's referenceable with the discussion. When you come back over here, you could take that document and say, all right, this is what we talked about. Let me transfer that in here. I added a bunch of notes to this document. I'm not going to add this to my QAPI meeting notes, but when you come to our page and you add all that information, then you can come to next. You're going to verify, say I'm not a robot. Just for good measure, you're going to submit the data. I'm not going to submit this one because I don't want to take from that facility. You're going to submit the data. And once you submit the data, you're going to be given the option of printing that document, and then you're able to print it. If at any point you're not able to print the document and you're misplaced an email that you received with the confirmation or anything like that, you will then be able to contact us and say, hey, Jess, or hey, Renee, by any chance, I need to add that to my QAPI meeting minutes. Are you able to provide me the report? We have access to those reports, so yes, we'll be able to download it and send it over to you so that you could have it, okay? But don't make it a habit. All right, so we're gonna have multiple facilities working on this and kind of engaging in this whole process and trying to make it easy as possible for all of you to be able to report your engagement of patients and family member representatives in your QAPI meetings. We are here to coach you. We are here to work hand in hand with you. We are going to be doing presentations similar to this one that you can watch in your own time. We know that time is of the essence for you, and you're being pulled in multiple ways. So we're going to make it as easy as possible so that whatever education we're providing to you, you can watch it in your own time. But we are going to expect that you're going to watch it, and you need to be able to let us know, give us feedback, questions. That's our way of engaging with us. And we want to be able to hear from you throughout the year. Don't think that, hey, I completed my 3 requirements of having patients in 3 months. We're done. That's it. Let's go on about our day. Oh, we haven't been able to recruit a member in the last 3 months or 4 months, and the network is not really paying attention to us. Yes, we are. We are just waiting for the right time. We're giving you the benefit of the doubt, basically, so that we can then kind of follow up with you and provide further assistance. So we'll be doing facility visits in the future. We'll be doing one-to-one coaching via Zoom calls, via telephone calls. So just look forward to that, and stay tuned for more information. Renee, would you like to add something and share something with the group?
I would. I just want to remind people, this is something that the network does on a regular basis, this QAPI stuff. This is what we do in our business. We're a quality improvement organization, and we engage patients in the work that we do. They are partners with us. So when we are looking at the indicators of what's going on in the facilities, you know, it's basically what you're doing. We're looking at infection levels that are affecting our entire network area, and we're identifying areas that need to be improved on that, and doing, you know, root cause analysis and rapid cycle improvement, but we're engaging our patients in that discussion. So this is something we're very familiar with and very comfortable in helping coach you through. So please, like Jesse said, feel free to reach out to us for some technical assistance.
Definitely. So with that being said, we look forward to your questions. We look forward to being able to share with us what are your concerns. Maybe we didn't cover a specific topic during this discussion. But just let us know. Let us know your questions, your concerns. If you find something that's very useful, we want to hear about that too. Tell us, hey, by the way, that was a good idea that you guys share that tool, or that you share that initiative. I really like that. We're definitely going to use that. Let us know so we know that's the best practice that we can continue promoting and focusing on. But Renee and I will be working hand in hand with all of you, and we look forward to a successful project. And as I mentioned, it's not just a one-year project. Although we're doing this focus in 1 year, we're going to carry you guys as facilities that we're going to be working year after year. So we're going to expect you to do it year after year. And if we lose communication for a month or 2 or 3 months, that doesn't mean we're not going to go back and look into that. We are going to hold you to that continued participation. So just know that from the start, that this is not something that's here for a couple of months and then it's going to disappear. This is meant to stay and adapt to the ways you're going to be doing this in the future. Okay. Well, with that being said, like I said, we look forward to your questions. Thank you all for your time today, and stay tuned for more. Thank you.
Thank you.